Hi there, folks. This is Dr. Ellenburg. Welcome to our medical show here on Fox News Talk 1020 AM. You also find us on FM at 95.5. You find us online as well at foxnewsKOAN.com. That's foxnewsKOAN.com. You can live stream us on the web. And, of course, this is a medical show here. If you have questions or comments about your health or about our topics, our number here is 522-1020. That's 522-1020. Let's remind you, if you find me during the week, you'll find me at the Ellenburg Center for Natural Medicine. Our phone number there is 563-2366. Our website address is drellenburg.com. That's Dr. and Ellenburg, ELLENBURG.com. Check us out, list of our services. We have just a website to learn more about your health and what things out in the environment and your food and various places and how they can affect your health. Has suggested readings as well as different books you might want to look at while you're there. And, of course, we do have archived radio shows on our website free of charge for downloading and listening to. So check us out at drellenburg.com. And again, a reminder, I do see patients in the Palmer and Kenai areas monthly. Give our office a call at 563-2366 for times and dates. All right, folks. Well, before we get started on today's show, again, some reminders. I am a naturopathic doctor in the state of Alaska, and there are some proposed changes to our scope of practice that the Department of Commerce, Community, and Economic Development is suggesting. Who governs NDs in the state of Alaska is the Alaska Division of Corporation, Business, and Professional Licensing, a division under the Department of Commerce, Community, and Economic Development. And what has been proposed is a limitation, in a sense, or a defining further the definition of dietetics and herbal medicine, and also what the word prescription means under the scope of practice section for NDs in the state of Alaska, again, naturopathic doctors. Well, what does this mean? Well, it's not a good definition they're trying to change. In fact, it's going to limit your access to health care. And even if you've never seen a naturopathic doctor in the state of Alaska, someday you might want to. And if these proposed changes go through with the state, it will limit a lot of what we can do to help you naturally and medically here in the state of Alaska. So we are encouraging anybody out there, as long as you live in Alaska or live in Alaska part-time, or I guess anybody can make comment, of course, is to visit our site at the Alaska Association of Naturopathic Physicians. And we have a quick link. It's just www.aknat.com. That's aknat.com, where we have a list of some comments already set up for you to make towards the state, or you can make your own comments in a section there. It'll ask for, there's your name and address, and you hit send. It literally takes a few minutes to make a comment, and we encourage everybody out there to make comments. The comment deadline is 4:30 p.m. on January 24th, approximately, of course, where we are. Today is the 14th, right? So, so 10 days from today. So please make comments. That's aknat.com. And again, it's concerning changes to the naturopathic scope of practice here in the state of Alaska that will limit what we've already been doing for a very long time. And we're not harming anybody. We're trying to help people out. And all we're asking for, at a minimum at least, is to keep things the way they have been and not have changes. Again, that's aknat.com. Please make comments. It takes literally, it's just a few minutes. And if this goes through, you'll be losing health care access to something you might use in the future or are currently using, like many Alaskans are. So please make your comments. All right, thanks a lot there, and we'll go back to that again later on today as some more reminders. What's on the docket today for discussion? Well, we're going to talk today about probiotics. That's the healthy bacteria living inside your GI tract that have an effects on your immune system, your gastrointestinal health, are involved in allergies in your body, and a whole host of other new conditions that are coming up monthly as more research is demonstrating what probiotics or what our bacteria in our GI tract are doing for us. We'll talk today, too, about radiation risk from CAT scans. I want to talk today a little more about coenzyme Q10 or CoQ10 in regards to using it in people who are having side effects or trying to avoid side effects from drugs such as Crestor, Lipitor, and Zocor. We'll talk today about erectile dysfunction being used as a cardiovascular risk factor in men and what that increases their chances of developing on the long term. And we will also talk about fish oil today as well, being used for depression and for anxiety. All right, and we'll go from there. And again, if you have questions, comments about your health, this is a live call-in show. You are encouraged to make phone calls here to us. Our phone number is 522-1020. It's 522-1020. And let's get started talking about some probiotics. And for many of us, when we hear that word, if you're not really involved in medicine or don't do much as far as supplementation in your life, you may not be quite sure what that word even means. And in this case, we're talking about the use of supplements, in this case, that are providing healthy bacteria, probiotics, for your gastrointestinal tract. You can also get it from foods such as yogurt, for example, kefir. There's even water kefir. You can also get it from fermented drinks like kombucha, fermented foods, sauerkraut, kimchi, just to name some different ones that do provide healthy bacteria that can be beneficial for your gastrointestinal tract. And inside our GI tracts, we have more bacteria than there are cells in our bodies by a huge margin. There's over 100 trillion bacteria. That's a giant number, by the way. 100 trillion bacteria in your GI tract. And what has gone on over the last many years is trying to discover as far as what are healthy types of bacteria in our GI tracts and how might those modulate or affect our health. And a big factor in talking about your GI tract health is your exposure, in a sense, to antibiotics. Now, many of us out there, including myself, have had several courses of antibiotics in our lifetime. I mean, at a point in my life, I think I was getting them every year for about 12, 13 years because I was getting pneumonia or bronchitis yearly because I had really bad asthma as a child and into my teens as well. And so I had fairly compromised gastrointestinal health. Many of us say, well, I've never had antibiotics in my life. I'm sure my bacteria in my GI tract are fine. Well, that may not necessarily be the case. Certainly there are antibiotics that are found in meats, chicken and beef, for example, that are used to decrease infection rates in animals so they can harvest more of them and sell more of them. You can also have it disrupted by the type of food you're eating. If you don't eat a very good diet, you're not going to promote good gastrointestinal health, and again, going to affect those bacteria. And another reminder, too, that's important to understand about the amount of bacteria in your GI tract is that half of your bowel movement, your fecal matter, that hopefully you go daily, is 50% of your feces is bacteria. It's not food, it's bacteria that are growing and dying every day inside there. You have your own little microbiota, as it's called, in your gastrointestinal tract that we're now beginning to discover that, we can have, it can increase your risk of getting diabetes, it can increase your risk of getting cancer, it may affect if you gain weight or lose weight. It certainly can affect if you have allergies or don't have allergies. And so we have some far-reaching effects as more and more is discovered. And even in the mouth, which is still part of the gastrointestinal tract, the bacteria in there can decide whether or not you have healthy gums, whether or not you get cavities. All those things come into play. So it's important to understand that your GI tract goes from your mouth all the way to your anus. That is your gastrointestinal tract. And there have been yearly, since about 2007, some very good conferences going on, one specifically that looks at probiotics. I went to one, not 12, but 11, 9/11 I went out, in September, 2011, I went out to Virginia to a probiotic conference. And one of the biggest far-reaching comments I will make about that, and also a recent gastrointestinal disease conference I was at in November of last year, is that when using probiotics as a supplement form or as some type of a treatment for yourself, people are not taking enough of them. There are doses that come in the millions of units called colony-forming units, or CFUs. We're talking about using units at least in the billions, if not tens to 100 billion units, as far as using them as a treatment to help, re-energize and also seed those bacteria in GI tract, specifically also as well if you've recently been on antibiotics. And there are definitely been some very good studies out in the last few years demonstrating that the occurrence of antibiotic-associated diarrheal infections, that means basically where somebody takes antibiotics and they get diarrhea that lasts a while, that can actually be on the decrease if people are taking a good level of probiotics while they're taking the antibiotic. You don't take it at the same time, but you take it at different times of the day to help seed and protect that GI lining. One area where we see a lot of problems in patients that probiotics may be helpful in is kind of this catch-all term, what's called irritable bowel syndrome, or IBS. And irritable bowel syndrome is kind of a diagnosis of, well, we're not sure what's wrong with you, so we're going to call it IBS. And these are individuals that may or not go on to develop things like inflammatory bowel disease, such as Crohn's or ulcerative colitis. You don't have to go that far, but just have a very sensitive tummy or a sensitive abdomen where certain foods might bug them, or they frequently have a lot of gas, or they may have a lot of this gurgling and a lot of noise going on inside the GI tract. These are the kind of people that it's worth looking at. Is in general, what can we do as far as helping out bowel health? And in many people who have irritable bowel syndrome, there are certainly imbalances concerning their healthy bacteria in their GI tract. And at a recent conference, Dr. Carolyn Dean talked about the numerous health effects from being exposed to high fructose corn syrup. And as you know, high fructose corn syrup is used in a lot of different things. In fact, I challenge you, and you can find these things. They're hard to find, but go to a grocery store. This is a standard grocery store here in the Anchorage area, for example, and try and find a loaf of bread that doesn't have high fructose corn syrup in it. You will find some, but they're not that easy to find. The majority of them have high fructose corn syrup in the bread itself. Of course, you find it in soft drinks and many other different types of sodas and pops and a variety of things that have high fructose corn syrup. Of course, a lot of candies. You'll find a lot of jams. So they're frequently used in a lot of different foods that are mostly processed, of course. And what's been interesting is that Dr. Dean recommended that one approach for people who have irritable bowel syndrome is to consider eliminating actually high fructose corn syrup from their diet. And it's not a bad idea anyways for all of us to be doing this, because high fructose corn syrup is not something we need in the first place. It's not really helping us out with our health. I was at a conference in 2006 where a doctor demonstrated via looking at the data that since the introduction of high fructose corn syrup in the mid-'70s, there's been a doubling and tripling of the occurrences of diabetes since that time, type 1 and type 2. So, it's not benefiting us. And with another thing that's important to understand, too, with irritable bowel syndrome is that it may typically not tend to be the fact that someone may even have food allergies. Maybe they internalize a lot of their emotions. I mean, one thing that I see not in all patients who have Crohn's or ulcerative colitis is they tend to internalize a lot of emotions, a lot of feelings, and sometimes can be quite introverted, which isn't a bad thing as far as the case, but they're internalizing so much that they're affecting their GI tract. And it becomes interesting. Now, how is it even possible? Well, for just about every neurotransmitter in your brain within reason that help send brain messages and the neurons inside your head, you can almost find every one of those inside your gastrointestinal tract. And so this gut-mind connection is a real thing. It really, truly is a real thing that exists. So stress, obviously, and the way we use that, the way we adjust to that in our lives, the way we deal with it can certainly have a big effect on what's going on inside our gastrointestinal tract. Another piece to consider, too, in patients who have irritable bowel syndrome is that they may have a yeast overgrowth, such as what's called candidiasis. And there's a certain type of yeast called Candida albicans that's quite common. And you tend to find some type of Candida in most people. As to what level it is, again, we all have a variety of things living inside of us. And again, many things can set us up for having overgrowth of yeast inside our GI tract, such as foods we've been eating, exposure to antibiotics, stress, and the like. And if there becomes high levels of the yeast inside our GI tract, it can certainly begin to affect the immune system of the GI tract. It can affect the intestinal lining and increase your gut to having what's called increased gut permeability, where things are going to cross over your GI tract because they're allowed to, in a sense. This permeability is increased, where something basically it's easier for it to get across than it was before. And this actually is a real term that's been used for a long time, and a more simple term is called leaky gut syndrome, which has been talked about for many years, but is now just finally starting to make it into the mainstream as far as a real diagnosis in a sense. And so if you do suffer from irritable bowel syndrome, please consider thinking about the use of probiotics, looking at ways to enhance, in this case, decrease your gut permeability, and using healthy foods to do that with. And there are many ways of doing that, and of course you want to see somebody who can properly guide you in that process. So that was one area that Dr. Dean talked about at the conference. It was very interesting. Another piece that we've talked about, I want to bring up again because it was quite interesting at the GI conference I was at in November, is Dr. Stephen Olmsted talked a lot about something called biofilms. And it's not something that just of its own in the gastrointestinal tract or your GI tract. Bacteria Even viruses, well, not so much viruses, but even funguses, for example, tend to secrete what's called a biofilm. If you kind of think about it like the shields in the Star Trek, they are around the organisms to protect them from what might come their way to get rid of them. And so when people are taking things to rid themselves, in this case, say of candida, they're taking garlic or they're doing things like oregano oil that are good antifungals. They're not killing off these yeasts to any degree they want to. And part of that problem can be is the fact that these yeasts, for example, secrete these biofilms around them that protect them. We see a lot of patients at our facility who have chronic sinus problems. And a lot of sinus problems, or sinusitis, even mild, can actually be due to a viral or a fungal origin versus a bacterial problem. In fact, there's been a couple different journal articles, I think, over this last year that I've brought up in the show here at least twice, talking about that a majority of chronic sinusitis has nothing to do with bacteria at all, and that a majority of the time taking antibiotics, which only kill bacteria, by the way, are useless. And a lot of people have chronic sinusitis, and the reality is they have some type of a chronic viral or chronic fungal problem. And in this case, and getting back, we'll probably correct that. The viruses do themselves also secrete a biofilm as well, as long as bacteria and the yeast, so they all can do this. And so one way of attacking these type of chronic infections is using agents that will disrupt this film that they're secreting, known as a biofilm. And it can be quite simple, such as, there's different types of enzymes that have been out there. There's a company for a long time been out there called a Vitalzyme that has serrapeptidase, which is shown to be a very good enzyme to break up these biofilms. Even oral EDTA has been shown to actually affect these biofilms. And typically EDTA is not absorbed very well across the GI tract to be used as a chelating agent orally. But in this case, who cares? If it's going to break up biofilms, that's where we want it to work, is inside the GI tract and not inside your body. It's literally outside your body. So some things to consider in trying to treat some of these really chronic infections is working against the biofilms. And again, more and more research comes out on these. We'll update you folks on that. But certainly something to think about if you've been fighting some type of a long-term GI problem or a long-term infection somewhere in your body, is to think about adding on board some biofilm disruptors, things that can break up that shield, so to speak, that are protecting those different microbes that are affecting your health. All right, well, let's remind folks what we're doing here today. It's Dr. Michael Ellenburg. It's our medical show here on Fox News Talk 1020 AM. We also find us on FM at 95.5 and online at foxnewskoan.com. That's foxnewskoan.com. If you have questions about your health or about our topics today concerning medicine, our phone number here is 522-1020. It's 522-1020. Let's get into a short topic here before the break. And I'm going to remind you folks, too, about what's going on with the state of Alaska concerning the naturopathic scope of practice and who to make comments to. Again, that is making comments to the Alaska Division of Corporation Business and Professional Licensing, which you can do via basically the internet through our site at www.aknat.com. That's the Alaska Association of Naturopathic Physicians. And our website address is aknat.com. We have some comments already there for you. It takes only a few minutes to make comments to the state and remind them you do not want to have limits to your health care here in the state of Alaska. All right, well, let's talk a little bit about CAT scans. And it's something that, hopefully in your life you don't need to get a CAT scan, but at times, since come up medicine, that they're a very valuable tool. And I don't know what quite year they came out. I want to say it came out in the early 70s, I think CAT scans did. And what a CT stands for is computed tomography. And it's basically using ionizing radiation to have a look-see inside your body. You can have one done on your abdomen, you can have one done on your chest, you can have one done on your head, you can have a whole body CAT scan. They've been around for many years and have been used quite well to help out a lot of patients and help doctors basically make a diagnosis that otherwise would be very difficult to make if the CAT scan was not available. The issue at hand is the amount of radiation that people can be exposed to when they receive those CAT scans. And let's hold that thought. We've got a caller online. Let's get to her for the break. Sandra, are you there?
Yes.
Hello there.
Yes, I was wondering, I really enjoy your show. Thank you for all the information you give.
Thank you.
What could be some possible reasons for my amylase level to be on the higher side for the last several months?
Okay.
Had it checked 3 times.
All right. Amylase, along with lipase, is typically in the body secreted from your pancreas. And if you're having some type of, in a sense, there's something called pancreatitis, which if you were having that, you'd know it because you'd be really, really sick. However, I would say there's even mild forms of pancreatitis that can happen in this case. And amylase can certainly be, if your amylase is elevated, and I don't know how far it's elevated exactly, but if it's elevated, is it several times normal or is it just barely elevated?
147 to 151.
Yeah, okay, that's up there. There's something irritating your pancreas. That's what I would suggest. Either it's dietarily, it could be food you're eating. I don't know what kind of diet you're eating, but fats can irritate your pancreas. I would even go as far as suggest that you could have even certain food allergies that could certainly affect the pancreas. I don't have any research to say specifically, and this article here says that, but I would say that it's in the realm of reason. Definitely alcohol intake can affect the pancreas. So these are things that you definitely want to kind of look at as far as dietary. What are you eating? And two, is it getting worse or kind of just staying the same?
It's just staying the same.
Staying the same.
Last several months.
What was the impetus to even look at the amylase? Because it's not a typical screen in a lot of patients. Was there?
Trying to remember. It was last spring. I think it was abdominal discomfort.
Okay, a reasonable thing to look at. And are you still having abdominal discomfort?
No.
Okay. Well, and you're saying it's maintaining, so it's not going down.
Correct.
Yeah. Well, something's still going on, and you may. If I saw it, I'd probably would suggest looking at the food piece. That's what I'd look at.
The food allergies?
Yeah, food allergy piece. And the problem that becomes there with looking at food allergies is that even if you get blood testing done, they're not a definitive answer. And one of the best ways to do food allergy testing is really on your own with following the guidelines of certain diets, like an allergy elimination diet, where you eliminate all the major allergens. I'll name a few, for example, like dairy, wheat, corn, eggs, soy, and then any food you eat on a regular basis. And eat kind of a clean diet for a period of time. And there's different, at our facility, we actually have one of these from Dr. William Crook. He's been doing this for many, many years. It's like a 6-page guideline. It's fairly well described, is the word I'm trying to find. And by getting off of those foods that may be irritants over a period of time, if you are in your case, it's a little bit harder because you don't really have any gastrointestinal symptoms. You only have what's on the lab work.
Right.
And so it'd be kind of a situation where maybe you do that for a period of time and then get checked out and see how things look. And if it's down, then you might know it's actually a food. The other thing you with doing allergy testing in this case with the food piece is that you'd be off those foods for a couple of weeks and then slowly reintroduce them little by little, where dairy would be for one day you pick dairy, eat a bunch of dairy, and then none for 3 days. You see if you had any changes gastrointestinal-wise. You could have joint pain, you could have mental fog. It could be a lot of different things, or none of those things. And then if that one's good, then the next food category comes into play. You could try that, and that would be helpful because something's going on. It's not normal for them to be elevated where they're at. That's for sure.
Right.
Okay. So that's the first place I start with. Beyond that, it'd be more of a detailed examination of seeing you as a patient, but that's an easy thing you can do on your own at home.
Okay.
Okay?
All right. Thank you very much.
Thanks for the call, Sandra. All right, folks, that's the sign that we're going to our bottom of the hour break. We'll be back here in just a couple of minutes. Hang on.
In the night so still, oh, how build you a kingdom in that house on the hill, looking out for love. Well, it's all.
Hi there, folks. This is Dr. Ellenburg. We're back to our second part of our medical show here on Fox News Talk 1020 AM, 95.5 FM, and online at foxnewskon.com. You got questions about your health there, questions about medicine in general, give us a call at 522-1020. It's 522-1020. All righty. Well, thanks for the call there from Sandra, by the way. And getting back to our discussion, before the break, we were talking about an article that recently came out entitled Many Patients Unaware of Radiation Risk from a CAT Scan. And the interesting thing about CAT scans is that they can provide a lot of information about the inside of your body, but you're being exposed at the same time to ionizing radiation. And many patients don't realize that. And the issue with ionizing radiation in this case is that your typical radiation dose from a CAT scan is comparable to kind of what they're calling here a yearly background exposure radiation from natural sources, or literally the annual limit for people who work in the nuclear industry as far as employees. So one CAT scan gets you what somebody who works in the nuclear reactor area does in a whole year. So, it's a lot and it's not a lot at the same time is. And the takeaway from this is that when you're using a CAT scan, when you are a patient and being told you have to have a CAT scan, have a good conversation with your provider and make sure this is the first place to go to. Sometimes on a few different things, it's a long list of things to get into, an ultrasound might be a better alternative to a CAT scan at a certain time, or if you need to have a repeat imaging technique, which would also include ultrasound or MRI, maybe MRI might be a better choice because you're not being exposed to ionizing radiation. CAT scans do have their benefit, and I definitely have ordered them for patients over the years. I'm not against them. I'm just against the overuse of them, and that's the concern to be as a patient. One last note that I will leave here is one study from the National Cancer Institute estimated there would be about 30,000 future cancers related to scans done in the year 2007 alone. And in that year, this is over 6 years ago, Americans had about 72 million total CAT scans, which is a lot. So just remember that when it comes time to being told you need a CAT scan, ask the questions, ask why you need it, and if it's necessary and it's going to provide more information than the risk, then it may be worth the risk of getting it done. Okay? And again, that article appeared in the Journal of the American Medical Association Internal Medicine's 2012 December edition. All right, caller on line 1. Jim, are you there?
Yes, I am. I'm off topic just a little bit,
That's
but
fine.
I heard a pretty good interview, part of it last night on another radio program. The topic was about a documentary called Farmageddon. It's a movie. I don't know if you've heard of this or not.
I haven't.
It has to do with the war on people who want to use non-pasteurized milk, and how they set up a little business with a farmer, and the farmer takes care of the cow and milks it, but the people that set up, they purchase the cow.
Sure, like a
and
co-op.
so they actually own it.
Right.
Yeah. So anyway, it did talk a lot of how so many people have had government, whether it was state or federal, might have been both even, crack down on these small farmers. And so the lady that did the documentary, apparently she did it mostly all on her own, just, grassroots kind of an effort. But I've heard from the interview last night that it's a really good documentary. So just thought I'd throw that out there. Farmageddon was the name of it.
And Farmageddon, like the word farm?
Yes, F-A-R-M is, I think.
Okay.
F-A-R-M, the way they
Okay.
had it. So, yeah.
Farmageddon.
Anyway,
Okay.
just thought I'd throw that out there. Just kind of, when you cross up the vested interest, look out. They come in with their guns, and they did, even where families were, just kind of innocently trying to use non-pasteurized dairy. So, well, anyway, I'll let you go. All
Okay.
right,
Thanks for the call, Jim.
Bye-bye.
Yeah, it's been a big thing for a long time. One thing about, I'll tell a lot of people, I'm not a big fan of milk. And they'll say, well, and I'll say, well, if you're going to drink milk, how about unpasteurized, like whole milk? I mean, the kind of milk that, Grandma and Grandpa were drinking back when they were children is a whole different story. And there have been several books written on this exact topic, how pasteurization ruins a lot of what is good about cow's milk in the first place, even talking about the use of goat's milk in the first place. But yeah, I've heard these stories too a few times, not about the exact movie that Jim's talking about, but I have heard of these. Dr. Mercola, Mercola.com, MERCOLA.com has a lot of information on this that you may want to look into as well, learn more about that. But thanks for the call, Jim, on that. And someone did call in and say that Farmageddon is on Netflix. So if you have Netflix, Farmageddon is on there. So I'll check it out. Thanks for that again, Jim. All right. Well, we finished our topic there today on radiation and CAT scans. Let's talk a little bit about CoQ10, and then we'll talk about erectile dysfunction in men and its increasing risk for cardiovascular disease in men. Last week we were talking about the use of coenzyme Q10 or CoQ10 in congestive heart failure patients as being a benefit based on a couple of different studies. And this week we're going to talk about the use of CoQ10 in treating what's known as statin myalgia. Statin myalgia is when people who are taking statin drugs such as Lipitor, Zocor, Crestor, just to name a few, statin drugs work at decreasing the ability of your body to make cholesterol. Well, that same pathway that those drugs are working on also is involved in helping your body make coenzyme Q10. And so what happens when people can get what's called statin-induced muscle pain or myalgia. And there's been a couple of different, actually been several studies looking at this specifically, but there were a few I picked off to here very interesting where they compared other nutrients. One being that they had patients taking 100 milligrams a day of CoQ10, another group taking vitamin E at 400 international units a day for 30 days. Both groups took it for a month. And not much change in the group taking for the pain score concerning those taking vitamin E, but out of over half of the people in the CoQ10 group reported a decrease in severity of their muscle symptoms in comparison, of course, to those taking only vitamin E. Another study also looked again at vitamin E and CoQ10, and again the results had about 40% reduction in pain for those taking CoQ10, and no change was seen in any of those taking vitamin E. And these results make sense. I mean, if you're taking a drug that's going to affect how your body is making CoQ10, it would make sense to replenish the, in this case, antioxidant or nutrient that you're losing due to the side effects of the drug you're actually taking. CoQ10 has been around for a very long time, since about at least the mid-'80s, I want to say, and has been in the market for quite some time. What's interesting is that Merck and company actually has a patent that is a statin drug along with CoQ10. They have not exercised this patent yet. I'm not quite sure why. One reason they mention here in this article is because there hasn't been enough data to demonstrate that statins actually cause myalgia all the time. Well, I will tell you the most common side effect from taking a statin drug, such as Lipitor, Zocor, or Crestor, for example, is muscle pain. So, they're kind of probably waiting in the wings when it's a good time to put it out there. And the sad part is that this has been known for some time, and what I find still very amazing at times to this day, is I learned this in 1999, okay? I learned this information. Not this particular article, but the information that, taking a statin decreases your CoQ10 output in your body. What's that, 14 years? And I can still see patients today at times who come in who are taking a statin or have been prescribed a statin drug, and they have no idea that it decreases their body's ability to make CoQ10. This is well-known information. So those of you out there who are taking a statin drug, if you're not taking CoQ10, you should be, okay? And if your doctor doesn't know that, then educate him or her about that so they know that it's important to be taking CoQ10. Again, the reason why? Because statin drugs decrease the ability for your body to make CoQ10, all right? And that has long-ranging effects, particularly on any muscles. And what's a big one in the body? It's involved in cardiovascular disease. It's the one you want to keep healthy, your heart. Okay, so CoQ10 if you're taking statins, and again on its own, if you're not taking statins, CoQ10 is wonderful for cardiac tissue. It's good for your gums. It's been known to decrease blood pressure in certain individuals as well. So it has a lot of benefits to it. Another drug that decreases the amount of CoQ10 in your body is a chemotherapeutic drug called adriamycin, and has been known to cause cardiac toxicity. So if you're ever, or doxorubicin is the same drug. So if you've ever been on that drug or know someone who's taking that drug for chemotherapy, they should be taking CoQ10. All righty, well, let's move on here today. We've got some more things to go over. If you have questions or comments about your health, I do appreciate the calls today. It's been great. Let's get some more if you want. Our number here is 522-1020. It's 522-1020. Well, one area that we don't hear a whole lot about, probably because of the issue of where it's at, is a discussion of erectile dysfunction, which can happen in men, which basically is having dysfunction in maintaining an erection. And this affects many men, thousands of men throughout the U.S. yearly, and probably in more so in the world. And in a recent article that appeared this month in a journal of Circulation, also entitled Cardiovascular Quality and Outcomes, they're looking at the diagnosis of erectile dysfunction, or ED, as a risk factor for future cardiac events. And it's about time this has come on board as a risk factor, because if a man has erectile dysfunction, it indicates they have circulation issues probably in other parts of their body as well. And one thing that maintains good circulation throughout your body is what's called nitric oxide. It's a gas your body actually makes. It makes it every single day. And it's involved not only in maintaining and opening your arteries of your body, but also it's involved in your immune system function. It's involved in the nervous system function as well. And it's been an area of much research since the 98, when there was a seminal article and research came out on the use of nitric oxide and how it's used in our bodies and how it can be enhanced. And in patients who have erectile dysfunction, you're going to have decreased ability for your arteries themselves throughout your body to dilate and open up. And that's going to increase your risk of what? And so in this article that appeared in Journal Circulation, it's going to increase your risk for overall cardiovascular events. It's going to increase your risk of dying from a cardiovascular event. It can increase your risk in the highest end from having a heart attack and also having a stroke. So for men out there who have erectile dysfunction, just don't think because if you're taking some drug and it's improved that you should be ignoring the fact that you actually have that. You should be looking at why you actually have that, and it's probably happening to the rest of your body. It's just it's basically a window of looking at how is the rest of your vascular system in your body, and it probably needs some help. And one in particular is talking about nitric oxide. Several of the drugs that are out there to treat this work specifically on the pathway that increases basically the improvement and release of nitric oxide in the body. Well, you can do that alone with just eating certain foods that can increase your ability for your body to make nitric oxide. Certain supplements as well. You can also take beet root powder. It can help increase your output of nitric oxide in your body. CoQ10 can help increase the output of nitric oxide in your body. So can B12. So these are all nutrients that can improve your output of nitric oxide and also probably help out erectile dysfunction while at the same time improving your cardiovascular risk. So we're going to start including this as far as cardiovascular risk factors. If a man is experiencing erectile dysfunction, they're already at increased risk for another cardiovascular event. So any of you men out there hearing this today, remember that. That's an important sign that you got to clean up your health even further. And beyond that, you might want to be screened for other cardiovascular risk factors, such as high cholesterol. But certain types of cholesterol is the key part of that. So have an expanded lipid profile, like we mentioned last week here on the show. Looking at things like how fast is your blood clot. Looking at kind of a fibrinogen. There's a marker called prothrombin time, or PTT, that can be looked at. Homocysteine, which is an amino acid your body produces. If it makes too much of it, it's typically due because you're low in B12 and B6 and folate. And too much of it can cause damage to the arteries inside your body and cause plaques to develop inside them because of that damage taking place. And so those are some of the big ones. Also, another key to this is inflammation. And we have a health panel in our own clinic where we screen. One of our health panel markers is looking at what's called C-reactive protein, or CRP, which is not a marker of specific inflammation somewhere in your body, but it's a marker of overall inflammation in the body. And if it's high, it increases your risk of having cardiovascular events. That's known as C-reactive protein. So C-reactive protein, fibrinogen, prothrombin times, an expanded lipid profile being included in anybody who has erectile dysfunction. And consider that condition as a cardiovascular risk factor. That's the important take-home from this piece of information today. All right. Well, we've got about 10 minutes left in today's show. If you got questions about your health or comments about medical things in general, give me a call here. It's 522-1020. It's 522-1020. And we will go on from there. Let's still talk about fish oil here for a little while. It's a great topic. And just omega-3 fatty acids in general, because you don't, if you're out there and you're individuals who are total vegan and don't want to be eating fish, you're going to want to get some type of omega-3 fatty acids in your diet. There are vegetarian sources of that are available, typically using a supplemental form. But for example, well, even krill. I don't know if total vegans will still eat krill or not, but krill is what the fish eat. And the krill are high in DHA and EPA. And in a recent article that's out before actual printing that appeared in the British Journal of Nutrition, an Australian study was looking at the particular use of an omega-3 fatty acid known as DHA, and noticed that there was a reduced risk of anxiety in those who were consuming higher intakes of DHA from their diet. Specifically, the highest intakes of DHA, again, an omega-3 fatty acid, were associated with a almost 50% reduction in the risk of anxiety disorders in a study that involved 935 women. Now, this interesting part of this study, which is kind of up for a little bit of argument with a lot of the folks who are kind of with or against the study, is that they also saw that in women who were taking consuming higher intakes of DHA, they were also about 70% less likely to report a current depressive disorder, suggesting that DHA might have a dual ability to affect depression and possibly even anxiety disorders. And in some individuals, depression and anxiety are present in them, both of them together. Yeah, the question comes to bear is, well, if these are a disorder that's probably coming from your brain, why is DHEA even going to do anything in the first place? Well, the important part to understand there is that your brain is mostly fat. In fact, the highest amounts of omega-3s in a human's brain are in the form of DHA and EPA. And so, and that's been known for some time, and I've mentioned before, I know here show several times in talking about a great book by Andrew Stoll, Stoll, known as the Omega-3 Connection, written several years ago now, but still a very good book, where he was using high-dose EPA and DHA in people who had depression or mild to moderate depression, and even those who had mild bipolar disease, where you have mania and depression mixed together. The thing about DHEA is most of us think about, well, if I take certain things that will increase the amount of it in my body somehow, like if I take flaxseed, for example. So flaxseed is an omega-3 fatty acid, but also contains omega-6 fatty acids. And again, omega-3 and omega-6 fatty acids are essential fatty acids. That means your body needs them. It doesn't make them. It needs to get them from the food, and they're essential. I mean, you can't live without them, okay? And in those who are trying to, or just in general taking, flaxseed has many benefits to it, and the main omega-3 fatty acid found in flaxseed oil is known as alpha-linolenic acid, or ALA, not to be confused with alpha-lipoic acid, also called at times ALA. This is what's found in flaxseed oil. It's called alpha-linolenic acid. And ALA has its own right as being involved in a variety of things, but if we see a picture of how flaxseed oil, in this case with alpha-linolenic ALA acid, is being broken down in the body, it eventually is supposed to turn into EPA and even DHA. The reality is we don't tend to see that, and this is not the first time I've seen this in an article where people think, well, I'm taking flaxseed oil, I don't need fish oil because I'm going to get it, it's going to be the downward, as we break down the flaxseed oil in the body, we'll eventually get down to EPA and DHA. Well, the problem is we don't tend to see increases in EPA or DHA when people are taking flaxseed oil. That's kind of the big point I'm trying to get at there. So if you're trying to get healthy amounts of DHA and EPA, you're not going to get it by taking flaxseed oil. Okay, at least not what we're seeing so far in the data that's out there. So again, anxiety, even depression, DHA and EPA may have a benefit with that. And certainly in anxiety, I've also seen patients use something called glycine, Glycine. It's an amino acid your body actually uses to do other things with, but it's a great mood stabilizer in a lot of patients. It's inexpensive. It's not sedative. It can be highly effective for people who are experiencing, certain periods of anxiety. It's not something I probably would take every single day, for that matter, but until working on why they actually have the anxiety is something you can take that has basically, it may have a side effect. Sometimes I don't know what it is, but it would take certainly super huge amounts of glycine to probably find out what a side effect of glycine would be. So a very, very safe nutrient for anxiety. The other part I'm talking about here in depression is, looking at what other categories should be looked at in somebody who has depression. And there was an interesting article that's come out called Lessons from the Heart May Reveal Diet's Role in Depression. And there's been a long-term kind of debate over, are there diets that we've actually seen that will cause, in a sense, depression? And the causational piece has been the harder part to kind of figure out. Do we have diets that people eating lousy diets and they're depressed because of the lousy diet? Well, I would say it's certainly possible. Knowing the nutrition that's involved in the brain and nutrition in the body, and knowing that, things like vitamin D, for example, if you're low in that, can cause depression and or anxiety. If you're low in EPA and DHA in your brain, that can lead to depression and or anxiety. People eating diets that are very, very low in protein tend to make smaller amounts of neurotransmitters, and that can affect how your brain's going to operate. So definitely diet has an involvement. And beyond all of that, to really get back to, can diet really cause depression, is considering a topic we discussed earlier today with the pancreatitis comment from our caller called in, is allergies can actually cause depression. Allergies can cause attention deficit hyperactivity disorder, known as ADHD. Allergies can cause anxiety. So now we're beginning to see that food allergies actually have a hand in affecting the brain. This is not new. This has been known for some time. Anybody out there who has a child who has, or has had a child who has autism knows for a fact that a lot of time food allergies are involved in autistic children and adults, where if they can avoid certain foods, their mind tends to be less hyperactive or just easier thinking, less brain fog. So a big area we're starting to talk about with patients, at least in my little world of people I see, is if we can't really identify a particular type of things and it's not situational as far as their depression or anxiety, is really considering having those patients do an allergy elimination diet for a period of time and see if their symptoms and how they feel clear up while they're on the diet. And if it does, then we know it's some type of foods. The problem is trying to figure out what they are. And I mentioned earlier today, that's how that's done, where basically people go on a fairly strict diet. All allergens are off the table, meaning no soy, no corn, no dairy, no wheat, any gluten of any kind whatsoever, no coffee. Anything people eat on a regular basis over and over again, like frequently, should be off the table. And yes, there are foods you can eat. Believe me, you're not going to be starving on this type of a diet. And then kind of seeing how patients do for a couple of weeks, and then have to introduce these foods back into their diet slowly but surely to see if they have any symptoms that could be mental, not just gastrointestinal, like abdominal cramping or bloating or loose stools. They could have joint pain. They could have a sinus problem. They could have a headache. And it might take a day or two for it to show up. That's the hard part. And the issue with doing food allergy testing is that it doesn't always, it can be helpful as a guide, but food allergy testing itself via lab testing is not definitive. Don't take it as an answer for yourself, for your child to say, okay, I'm fine, or they're fine. They don't have food allergies. That may not be the case. All right? Really, really important to understand that piece. And hopefully someday we'll come up with some better type of food allergy testing as time goes on. Most of our current means of doing that, mostly look at what's immediate versus what is delayed as far as your reaction to foods, but still the gold standard being eliminate the foods and see how that person does. It's a great thing to be doing. And again, it's called an allergy elimination diet. We use one from Dr. William Crook that was developed in the 70s. I'm sure you can find that online. All right, folks, reminder that our time is up today. Again, we're encouraging anybody out there to please visit aknat.com to make comments about not making any changes to the scope of practice for NDs in the state of Alaska. That's www.aknat.com. Please go to our site, make comments, so you don't have changes to your healthcare here in the state of Alaska. That's aknat.com. Thanks for listening. We'll be back in a week, and take care.
Big round people in a cool little square. Or you can cut it with a boat or a plane. Man, it's gonna take a new train. You'll be leaving on a new train, far away from this world of pain. And when you look out your window, you'll see your home, your baby,